Welcome to Issues and Answers with Diane Kinderwater. Issues and Answers is presented as a public service to inform, educate, and better the lives of New Mexicans. And now, Issues and Answers with your host, Diane Kinderwater.
Welcome to Issues and Answers. I'm Diane Kinderwater. Thanks for watching. It's a crisis. You know it. I know it. Our city officials, state officials know it. We have a problem of homelessness on our streets. We have a problem of mental health issues that are not being addressed correctly. We're trying. Apparently, we have spent millions and millions of dollars on this issue, but the fix doesn't appear to be there. And there's a great demand across the population for a long-term fix to our homeless population, mental health issues, and the addiction problems that we're seeing in our streets and in our homes, in our neighborhoods, everywhere. My guest today, she is Connie Elizabeth Vigil. She is a lobbyist, a kind of self-trained lobbyist who's had a great impact with the legislature on this issue, the issue of addiction, homelessness, and of course, people who have behavioral health problems. There was Connie Elizabeth Vigil helped pass SB, Senate Bill 1, which is a landmark behavioral health bill to create long-term solutions for these problems. We're going to hear from Connie Elizabeth Vigil and how this road to getting this bill passed took effect, and how she wants you to understand what the problem is, and how there is going to be money in our future for long-term solutions. And we're going to discuss all this with Connie Elizabeth Vigil right after this. Stay with us. We seem to all want to have a permanent, long-term solution to our problem of addiction, our problem of homelessness, of mental illness in our community. They're there. We know they're there. It's a crisis. But the legislature passed SB 1, and right here with me, Connie Elizabeth Vigil helped with your input have this bill passed, and we're looking at perhaps $1 billion of our taxpayer dollars, $1 billion by the year 2027 to go towards finding a long-term solution. And there could be a solution in Miami-Dade. Miami, the city of Miami and Dade County, which is in Florida. You've gone to visit their models and you say it looks like they work. But thank you for being part of this program.
I appreciate the opportunity to let people know more about it. And
I speak about SB 1, Senate Bill 1, but there's also going to be a Senate Bill 2 and 3. But give me a little bit of background, please, Connie. I mean, this has been something in the works, but something that just passed in the recent legislative session. And of course, when this program airs, we're looking at another legislative session and perhaps passing Senate Bill 2, 3 that complement our Senate Bill 1.
Sure. Well, just so you know, Senate Bill 2 and 3 passed alongside Senate Bill 1 as complementary bills. I'm a lobbyist, but I call myself sort of an influencer, but I'm also a good communicator in that I've talked to people across the state of New Mexico about the issue. It doesn't even just affect Albuquerque. Of course, every community in the whole United States sees the issues. I formed a business group in which I can say that one of my business members brought the Miami-Dade program to my attention through a video, which I highly recommend, called Definition of Insanity. It was a PBS documentary made in 2020 about Judge Leafman and his entire process over 20 years to build one of the most successful models in the whole United States.
A model to help fix the state's homelessness, addiction, and mental health. Yes. Miami-Dade has a program, and you said there's a PBS special called what? Definition of Insanity. And of course, we know what the definition of insanity is doing the same thing over and over and over, thinking you'll get a different result. But that's what insanity is. You don't get a different result if you do the same thing over. But it sounds like Miami-Dade is doing things differently. And of course, here in the state, we know for years and decades, we've been spending taxpayer dollars on finding solutions to our homelessness, to addiction, which is ravaging our communities and our children and adults. And of course, the mental health issue. Right. We're spending money, but we're not getting the results. We might finally find a program where we're going to find results,
Yes, absolutely. And I give a shout out for the 50 or so leaders from across the state who have attended a 2-day training. Miami-Dade Judge Leafman, Stephen Leafland, actually started doing training. And he has a 2-day program which many people in various communities across the state, including this last May, Senator Martin Hickey, Representative Marion Matthews, and I want to give the biggest shout out to Adrian Avila. He's the director for staffing for Senate Finance under Senator George Munoz. He attended last September and helped to roll out these three bills.
We're going to talk about the bills, but can you first tell me what the hope is? What the hope and the solution that Miami, Florida, Dade County, Florida, has found. Tell us, why are they doing something so different that's having an impact and a positive effect on this?
Well, my background is medical research. I worked in the field for almost 18 years, even worked on studying schizophrenia at various medical schools. And the real issue is to really find a solution, you've got to study the things that are already out there. In research, you look at other people's publications. In this case, I've been studying what other cities and counties have been doing for years. But the Miami-Dade program came across, my attention. I watched the video, got in touch with Judge Leafman, found out more about the deep-seated effect of 20 years. Miami-Dade also studied and is using models from other parts of the country. For example, they've used treatment diversion programs for training of law enforcement officers from everywhere across the United States. So they took the lead from other counties and cities, and they incorporated
that
it.
Worked,
Exactly.
they incorporated into Miami. So can you tell us kind of in a nutshell, what are they doing step by step? I mean, it can't be a nutshell.
Sure.
Tell us how they can have an effective program. Why is their program so different?
Well, it's different because the main priority they're focusing on is really a health issue, which mental illness, drug addiction, co-occurring, that's a health issue. What does it do? It leads to crime, juvenile delinquency, it leads to all kinds of bad things, and eventually most of the population with mental illness and drug addiction issues end up in jail.
But Miami-Dade is treating it as a health issue, which it is, because it's mental health problem, behavioral health, and the addiction is addicting with your body, so it's a health issue. So so they're not putting people in jail? What are they doing that's different?
They initially started out looking at just misdemeanors, which is lower level crimes. Okay, these are people that are arrested for lower level crimes. They started a pilot program, utilizing treatment of those misdemeanors individuals.
They started with the misdemeanors before they became the big, serious felony crimes that impact all of our lives. So give me an example, a misdemeanor, shoplifting, a mentally ill person with shoplifting.
Could be that, could be, indecent exposure, whatever the case might be, of someone who has a mental illness or drug addiction issue that's, being arrested in society.
And there they weren't arresting them.
No, they decided that rather than put them in jail, which doesn't help them at all, they devised treatment.
Okay. What other kinds of crimes? Can you name a few?
I would say the obvious ones to me, as far as someone with a mental illness, might be burglary, trespass, vandalism, indecent exposure. And sometimes they, depending on the severity of the mental illness, they can become quite dangerous, which leads into further crime. But I think
right. But if they stop it, so in Miami-Dade, they didn't arrest for these misdemeanors.
Right.
They found health health help for them.
Yes. Jackson Memorial Hospital is the main center of care, but they've since built a 200-bed treatment facility in downtown Miami. So what that will do is take people who previously may have been arrested over and over for these misdemeanor crimes, but they brought the level up to now at the level of felonies, second and third, but the criteria is be nonviolent.
So now they're not even arresting felonies, second and third degree, if they're not violent.
Yes.
Can you give me some examples of what kinds of crimes those are?
That
higher amount of burglary, I imagine.
It could be
breaking and entering. What?
A little bit. Anything that you can consider. In New Mexico, I think we have a $1,000 limit for theft and that kind of thing. But, the felonies can even include, as far as trespass, you know, if you're vandalizing and you do serious damage to a business, that kind of thing. But in New Mexico, it could also include maybe some lower level drug crimes, you know.
Selling drugs or what?
Well, I'm not an expert in the legal field, but I would say a lower level amount of whatever the drug is.
Okay, so this successful Miami-Dade program doesn't even arrest for some felonies.
Yes.
What do they do with the people who are still, you know, harming other people's property but aren't violent? What are they doing?
Well, they're focusing again on the treatment side. So they remove them from the jail cell. They bring them into a treatment center. In this case, the 200-bed will soon be open. But Miami-Dade Jackson Memorial Hospital right now is the main center of care for individuals. They treat them where they're at. Maybe it's a DWI. Maybe that person has a home, a family, a job. So in that circumstance, maybe assisted outpatient treatment, just going to regular meetings with the judge, PD, DA. See, that's the key. You've got to bring everybody in the criminal justice system together to bring those individuals a series of events that will lead them to success. Basically diagnose, have a plan for treatment, help them all the way through to helping them get housing and a job. And Miami does that very well. Because if you don't have a job and you don't have permanent housing, you're going to end up right back in the same situation. And for me, long-term recovery is the key. Their programs last up to a year, and they go beyond that, because someone with an addiction, that's a lifelong problem. But they do have other supports, such as transitional housing. Camilla's house is a 4-story transitional housing support for voluntary treatment. But their program is looking to expand into the community itself for juveniles and people not in the criminal justice system itself, but they initiated it with those what we call frequent offenders who have multiple arrests and have been in jail multiple times. So that was the population that they focused on in the beginning, but now they're opening it up to other individuals. And I think New Mexico's looking at that as well, because the juvenile issues in terms of homelessness, drug addiction can become quite severe.
But Connie Elizabeth, it seems like we have a lot of these traditional housing. I mean, there's a lot of nonprofits out there that our taxpayers pay for. The nonprofits that receive a lot of money from the city of Albuquerque, from our sales tax, a percentage is going to them. They're all out there. We interview a lot of them on this program. So we have a lot of transitional care, and it seems like we have a lot of help out there.
It's not working because it's not comprehensive. They're not working with the district attorneys, the DAs, the judges, the public defenders, and the judges who give these people basically their lifeline to how they're going to proceed. The biggest factor is facilities. Name one long-term mental health facility in the entire state of New Mexico, let alone Albuquerque. I mean, one where someone with a deep-seated mental illness or addiction can go for full recovery. And that
I thought we had the, what is it called, the Gateway Centers for
the Gateway
homeless?
Center is currently, again, more of a shelter. It was originally a bond in 2019 that Mayor Tim Keller got, basically for a shelter. It's become sort of a little bit of a treatment center in that we do have a triage, but it's not intended for the purpose of curing anyone from any particular mental illness. It's not a long-term facility, but it could be generated into a longer-term facility. The other caveat that I want to mention is Department of Health. We have several agencies within the state of New Mexico who have facilities already. The largest one is Las Vegas, New Mexico Mental Health Center, okay? And we also have one called Turquoise Lodge here in Albuquerque. It's now being housed at the Gateway. And a third one, the Roswell Rehab Center. All of them are intended for rehab, especially the Las Vegas Center, which focuses on mental health. But unfortunately, what happens in Las Vegas is a lot of what we see as far as the latter end, when someone's arrested for a serious crime like murder or something else. They end up there if they have a severe mental illness. The forensic unit has just gotten a huge amount of money to remodel that side. But I see Las Vegas, Turquoise Lodge, the Gateway, and Roswell Rehab as facilities that already exist that could be a longer-term solution. And I think it's very hopeful that now the state has proposed a long-term strategic plan within the Senate Bill 2 and 3.
So these facilities aren't operating as the Miami-Dade model at this point?
No, not at all.
Not at all?
Not at all.
Because they don't have the coordination with the judges and the DA and that intensive plan.
And the unfortunate piece is the workforce. And the workforce development is a key piece. We need to figure out how all of our universities can combine efforts. Today at the courts correction meeting here in Bernalillo County, UNM presented. Luckily, we have a brand new PhD named Dr. Otto. He's coming from Florida, so he knows the Miami model, but he's trying to build a system of care within the University of New Mexico with psychiatrists, psychologists, and other healthcare providers, and I hope that will expand to all of our universities so we can collaborate, share students, and bring students from out of state into New Mexico.
Now, does Miami do that?
Yes,
the
they
universities
do.
As well?
Yes, they combine efforts with all their universities, and in fact, they just had a bill proposed for certain of their medical schools and hospitals to be training centers. And they're focusing a lot on coordinating the care from university to university, sharing programs and students such as UNM. Dr. Youngren has a very good PhD postdoc program, which is now leading people from a PhD to working directly with Sam Bregman in the DA's office where they need people to diagnose people sitting in jail. So this is all, state-of-the-art stuff coming out. UNM's very much involved. Of course, they're starting their School of Social Work, but when you look at the careers that we'll support, you're looking at a CNA, which is day-to-day care, a social worker, day-to-day care.
What was the first one?
A CNA. A CNA is a certified nursing assistant who works day-to-day, typically in a long-term nursing home care setting, which is what you need initially for the initial stages of treating people. And then, of course, you've got your social workers, but you also have very strong programs like nurse practitioners, physician's assistants, master's levels degrees with certain licensing that can also, the two key elements are diagnose and prescribe. You have to be able to diagnose what that person has in order to put them in a system of care. And basically a health plan. It's just no different than if you had prostate cancer. What course of care would your doctor advise? Would he say, well, 6 months because we're limited? No.
We're limited. We don't have any more space, so you're 6 months in and out. Hopefully the prostate cancer's gone, but probably.
Unfortunately, we've been depending on Medicaid dollars, which up until now have not supplied a long-term
Anything
care.
else you'd like to share with this Miami-Dade program that's different? Before we get into our billion-dollar
sure.
plan.
Well, the Miami-Dade program has got a leader in Stephen Leaflin. He retired as a judge, but he started his own company and he's continuing these 2-day trainings, which I really want to promote because I see every single community, law enforcement, public defenders, prosecutors, judges, even the medical care going to Miami to see what they're doing, and that will lead us into exactly where we need to be. And I think we're on the right path with these bills because they're asking for accountability, long-term planning from all the communities in New Mexico, which is a first.
Which is a first towards the long term. Now, Senate Bill 1 passed, a bipartisan bill, and I think the state so far has allocated $150 million into that. It's kind of like a trust fund with a goal of reaching $1 billion in just 2 years.
Yes, that's my understanding from talking to Adrian Avila, who is the main drafter of this bill. But if you think about it, our early education fund is well into the billions. We've never actually set aside funding. It's always been short-term capital outlay, and now we have a permanent source that will build on its equity. So that'll be a win-win.
Have you heard, and you said a number of legislators have gone and you proposed people go. Is it a 2-day training that you're suggesting, or just go through the model in Miami?
It's a 2-day training.
Oh,
it's
that
very
they can see it.
extensive.
Okay.
Law enforcement, medical staff.
But oftentimes when people go see a program that works, they come back home and it's not implemented.
Exactly. But part of the funding in SB 1 is for implementation. So the key piece is, okay, number one, educate yourself. Okay, you have to understand how does it work. Along with the physical end of it, they have laws that have passed in Florida which allow judges to put someone in a state of guardianship if they need to, but they've built the laws so that it'll give the public defenders, the prosecutors, and the judges the tools that they need to put those people immediately in the treatment that they need. If you think about it, it's more humane to treat someone than to watch them to overdose on the street. And I think that's something that I think a lot of people recognize with family members and loved ones who have unfortunately passed away.
But the other side, though, also, Connie Elizabeth, is the victims of these crimes. They want to see some justice for their loved ones who have been hurt by someone who is addicted, someone who is mentally ill, someone who is homeless. So there's that side of people saying, no imprisonment, putting them in jail will keep them away from society and not hurt other family members.
Well, we have to recognize what just happened, the brutal stabbing of a young girl on a bus. Basically, you're going to see that happening repeatedly unless we start treating people early. From the very beginning, not waiting until they are in and out of the system. They get further and further beyond, and they do get very violent. They have, obviously murdered a law enforcement officer in Las Cruces last year. We've seen it in our community through, fires and all these things that happen. A lot of things that people don't recognize are violent offenses, but if you can catch them early and you can treat them, you might eliminate that unfortunate violent end that, honestly, what else can you do? You have no recourse at that point because, unfortunately, it's really hard to, transform someone who's already committed a heinous murder. But
so it's catching them early with those misdemeanors.
Exactly, and the youth.
But I thought here in Albuquerque we don't even really charge some of these misdemeanors. If they steal something from a store, it has to be a certain amount, otherwise they're just let go.
Well, you're exactly right, and I think we've lowered the bar too far because we're losing that opportunity to catch that person in the first or second offense rather than see them repeating 20 or 30 times and to the point where, okay, then they cause some real serious issues. They cause harm to themselves and others. They cause harm to our law enforcement. Even our first responders are put at high risk. And so I'm saying prevention is part of SB1, but also looking at building up a system of care. That's so critically important. And everyone going to Miami, because it's not just going to see the buildings, but it's listening to people who tell their stories, like the law enforcement that go out every day. The law enforcement do the outreach in Miami. It's not like we have the
social workers doing
it. Social workers, because they have the ability to bring someone around to bring them into voluntary treatment. Now, your comment about housing was critical because this isn't a free ride. Along with them agreeing to go into the program for the treatment, guess what happens at the end? Their sentence is released. We don't do that in New Mexico. Even if they've gone through adult mental health court or DWIs, they still have the stigma of having that arrest record. And Miami is recognizing if they are deep-seated in the program, we will release their record, which will help them to get jobs and back into the community, which is so critical.
And you said that program's been going on 20 years.
It started 20 years ago, basically from a couple different factors. One was a federal lawsuit, because the Miami-Dade jail was horrendous. There were people on the floor. It was just a horrible mental illness psychiatric ward, basically.
Can some of these mentally ill people be treated and cured?
Absolutely. If you watch the video, there's a young man named Justin Thorpe. He tells his story of how he was once on the floor at the jail being arrested for some mental illness, and he ended up being a spokesperson, has talked to Congress and worked with Judge Liefman. He's in the video, and he is a prime factor of what happens when you get the right diagnosis, the right medication, the right support. People in the general community have loved ones with bipolar, schizophrenia. With the right conditions, the medication, and the support, they can live a normal life.
With this SB1, 2 and 3, and the $125 million we have now growing to $1 billion, is there a commitment to try this model?
Absolutely. In fact, they've started rolling out how they will separate out the various communities. They've decided through the judicial districts, which are pretty much the counties that are close to each other. You can see a map that they've already created. Several different districts, I think there were 13 that I counted last time, 13 regions, based on their proximity in the judicial district, where they're going to start rolling out the sequential intercept model. And that's what Miami-Dade has used as their model for treatment.
But when are we going to decide to take people with low-level crimes and put them into the give them the option of going?
You know, that's something that I don't know that's been discussed yet on the misdemeanor level, although there are various pilot programs across the state to look into diversion. That's mostly on the young adult side, mental illness, but I think looking at the youth and looking at misdemeanor side for treating those people, it will avoid them becoming worse criminals.
But we don't have a commitment yet to do that here in the state of New Mexico.
Not to my knowledge. I think right now we're still trying to figure it all out, to be honest with you. They just wrote HB 8, which talks about competency and that kind of thing. But to me, competency isn't the real issue. The real issue is if that person obviously needs treatment, then let's find a way to do that.
And we have perhaps the money to do it in this trust fund.
We definitely
up to
do.
$1 billion. Thank you, Connie Elizabeth Vigil,
Thank
for
you.
reaching out to KCHF TV to begin explaining this to us. We'll have you back as the legislature progresses on this. And thank you for giving us some hope.
Thank you very much, because I think this is a topic people need to get involved with. You need to find out who your elected officials are. Are they on board with this model? Because that'll be a key factor to success.
Thank you so much for the success you've had. Appreciate
Thank you.
it. And thank you for watching the program. I'm Diane. Make it a great week. We'll see you next time. Bye-bye.
Issues and Answers with your host Diane Kinderwater is presented as a public service to inform, educate, and better the lives of New Mexicans. To comment on today's program, email us at info@kchftv.org or call us at 505-345-1991. Join us again for Issues and Answers with Diane Kinderwater.